Kevin Ndirangu. I am a consultant physician, or what in some places called internists, practicing in Kenya, in the central part of Kenya, formerly Central Province, and now we are in Nyeri County. I work in both private and the public sector, but most of my work is mainly in private practice, both in my own private clinic and also with several private hospitals in the region. I pursued a postgraduate course in diabetes under the Merck Foundation Nationwide Diabetes and Hypertension Blueprints program, and finished the course in September last year, 2023, and I've already in fact received my certificate of completion of the course. The course I pursued, if I can talk a little bit about it, it was quite wholesome, meaning if I look at diabetes and what you're supposed to know about diabetes, we touched on everything. The faculty was very good, quite knowledgeable, approachable, easy to interact with, and they give us a lot of time to interact with them. They were there for our questions, to guide us, mentorship. I was very satisfied with the way the course was organized. The mode of study, I did the online course using Moodle. The platform is very easy to learn. It's very versatile, without any challenges. As long as you have good internet connection, we didn't have any problems. And the way the course was structured, it gave you enough time to tackle different topics and work on your assignments and do revision. So you didn't feel hurried. So you could do it at your own pace. Very well organized, I might say. So I consider myself a diabetes scholar, and that was, I would say, the first step in this journey. So it really gave me a baseline of, in terms of training how to be a diabetologist. By going through the course, it has really changed how I approach patient care, patients with diabetes. I have more information, more up-to-date information about managing diabetes. It makes it easier for me to interpret different studies that come out every day and apply those to patient care. It has also helped me organize my private practice such that now I have a dedicated diabetes outpatient clinic where we look at the overall care of a person with diabetes. It has helped me to introduce different things that are not usually done mostly in this region. In nutritional therapy, helping patients how to do self-monitoring of blood glucose. I'm in the process of setting up a diabetes food clinic. So it has really changed how I approach patients with diabetes. And we've seen improvement in outcomes of these patients in terms of we are now getting less complications from diabetes. Before I even completed the course, when I got accepted and started training, I was able to join the professional society that deals with diabetes that in this country is called Kenya Diabetes Study Group. I became a member, and through that society, I'm able to participate more in terms of promotion of diabetes care in the country, promotion of policies with public institutions and the government, promotion of education into the healthcare, the other cadres of healthcare, our junior doctors, the nurses, diabetes educators. And in fact, we've just completed 1 year training of junior doctors in diabetes care under something we were calling a Doctor County Initiative, where we're meeting every month to look at different aspects of diabetes. So just by being accepted by the Merck Foundation, given an opportunity through a scholarship to train in diabetes, it's given me so many opportunities. Both these opportunities have benefited myself, they have benefited the community, and I believe I'll continue achieving more as time goes by. It makes it extremely likely for me to refer some of my colleagues. In fact, I've done so to a few people. Because one, I did the course under a scholarship, so I did not pay anything. So my cost was zero, just the cost of internet connection. And it sets you up, opens your mind such that now you start a journey of becoming a subspecialist in the area of your interest. We, in this region, we have gaps within our healthcare system, or we lack some specialists and even specialists in some areas. So the more of us who get to train, the better it is for the community and for the practice of medicine. Yes. I do not have enough words to thank the Merck Foundation, because it is not every day that you get such an opportunity. I know the cost is costly if I was to pay out of pocket. Thank you, big thank you to the Merck Foundation. And I know, apart from myself, they have done this with a lot of doctors in this country, and not just in diabetes, even in other specialties. I would urge them to keep on doing the good work they are doing in promoting, there's people to attain knowledge, because we have a big deficit in specialists in this country. The other thing is that of course, this was a stepping stone, it's the start, okay, and therefore, if there are other opportunities that might come along, we would be very happy to take part in those opportunities. So thank you very much.